This is Plant-Based Briefing, 5 Simple Ways to Improve Kids' Gut Health Using Diet and Lifestyle, Part 2, by Ocean Robbins at foodrevolution.org. And I'm your host, Marian Erickson. This is the curated content plant-based podcast where I narrate articles on healthy, compassionate, and sustainable living with permission in about 10 minutes or less every weekday. This is the second half of an article because this one would have been longer than 10 minutes, so I read the first half yesterday. Go back and listen to that first so that this one will make more sense, and then jump back here for part 2. And now let's get to today's plant-based briefing. 5 Simple Ways to Improve Kids' Gut Health Using Diet and Lifestyle by Ocean Robbins at foodrevolution.org. Number 3, ditch sugar, flavorings, and dyes. If you've ever pushed a shopping cart down the cereal or candy aisle, you know that the industrialized food supply loves to add sugar, artificial and natural flavorings, and synthetic dyes to foods targeted at kids. And while no parent wants to experience a toddler meltdown when you refuse to toss the Lucky Charms or Skittles into your cart, the effects of feeding kids these ingredients may cause a lot more grief in the long run, both in terms of health and behavior. Remember that anything that harms the gut also harms the brain, and that's especially true for children. While you might be able to get away with an occasional junk food item, children are more susceptible to the effects of chemical compounds for a few reasons. First, kids are smaller, which means their relative exposure per pound of body weight is greater than that of adults. Second, their body's ability to metabolize, which in the case of unhealthy ingredients means detoxify, is immature. Third, their key organ systems are still changing and developing, making them highly vulnerable to disruptions. Excess sugar feeds certain microbial populations, which can turn on genes that code for sugar metabolism and transport, increasing the risk of type 2 diabetes and obesity. Real sugar is bad enough, but high fructose corn syrup and other corn-derived food additives found in many processed foods come from GMO corn, which is sprayed with glyphosate, aka Roundup. This chemical may disrupt and kill beneficial bacteria in the gut, leading to impaired immune function. Artificial food colorings have also been shown to disrupt the gut microbiome in children, and there's increasing evidence that kids who consume synthetic food dyes on a regular basis are more prone to ADHD and other neurobehavioral issues. The FDA's estimates of how much is safe appear to be way too lenient, according to research conducted in 2021 and 2022 by the California EPA's Office of Environmental Health Hazard Assessment. Number 4, eat prebiotic and probiotic foods. So, if candy corn and frosted strawberry Pop-Tarts are off the menu, what foods do protect and improve children's gut health? 2 categories emerge as clear winners: prebiotic and probiotic foods. Probiotic foods help with digestion and eliminative health. Kids prefer to call this pooping, and they're good for both avoiding constipation and diarrhea. While children may not appreciate the intense flavors of popular probiotic foods like sauerkraut and kimchi, they may enjoy fermented pickles and plant-based yogurt, maybe not on the same spoon, or a teaspoon of Inner fermented coconut water. However, you can eat all the probiotic foods in the world and take massive doses of probiotics in supplement form, but unless you provide these beneficial bacteria with the food they love, they won't live long enough to do much good. That's where prebiotics come in. They feed the probiotics. And the main prebiotic is a nutrient sorely lacking in most people's modern industrialized diets: fiber. Not enough fiber is associated with a number of gastrointestinal issues, including discomfort after eating, constipation, and obesity. Prebiotic fiber may support gut health for kids by modifying the composition of the microbiome in the large intestines. Think of it this way: if you scatter nuts in your yard, you'll attract squirrels. Put out a salt lick and the deer will come. Set out a giant bowl of leafy greens, avocado, sweet potato, and quinoa in a peanut sauce, and you might find me. If your kid eats a sufficient and diverse quantity of prebiotic fiber, the good bacteria will stick around and reproduce, creating a healthy and resilient gut microbiome. Some of the best good gut bacteria include bifidobacteria and lactobacillus. By serving as nutrition for probiotics, they support gut health, metabolic health, and immune function. Some kid-friendly prebiotic-rich foods include leafy greens, legumes, jicama, Jerusalem artichokes, and bananas. It's good to know that in a world that poses so many dangers to microbial diversity, nutritional strategies, which can be largely in our control, are among the best ways to repopulate children's guts with beneficial bacteria. Number 5, use antibiotics mindfully. If the opposite of pro is anti, then the opposite of probiotic is antibiotic. Yes, those miracle drugs that have done more to reduce human mortality than perhaps any other medical advancement in history have a problematic side. When used appropriately, antibiotics are a blessing and can cure a wide variety of infections. But the etymology of the word should give us pause. Antibiotic literally means against life. And the broad-spectrum antibiotics that science has developed in the past 90 years don't discriminate. They kill, or attempt to anyway, all bacteria, not just the pathogenic, disease-causing ones. When a child takes antibiotics, their microbiome can become severely depleted, creating a vacuum that often gets filled by harmful bacteria, especially if their diet isn't that great. See point number 4 above. Infants who receive antibiotics display microbiomes that are immature compared to similarly aged babies who have not been exposed to the drugs. And these immature microbiomes predispose their owners to a variety of health conditions, including asthma, allergies, and growth dysregulation, which can include both obesity and stunted growth. As a parent, how do you protect your child's gut from antibiotics? First, make sure the drugs are truly needed. Many health professionals prescribe antibiotics without performing due diligence, like not assessing whether the drug will effectively target the germ of concern, or even confirming that the infection is bacterial in origin. Antibiotics do nothing for viral infections. If your child is sick, ask your doctor if the illness is bacterial or viral. If it's bacterial, ask about the risks and benefits of antibiotics versus other treatment options. Humans have dealt with infections for millennia before pharmaceutical antibiotics were discovered, so we often have ways of recovering naturally or with the help of other effective treatments such as herbs. See herbal alternatives to antibiotics linked here. If your child truly requires a course of antibiotics, then providing them with plenty of prebiotic and probiotic-rich foods is important, both during the treatment and especially for a month or more afterward. This can help replenish and support their microbiome to pre-drug levels. And if your child develops acute GI issues related to antibiotic use, consider asking their healthcare provider if a supplement such as Complement Gut Nurture could be age-appropriate and helpful to resolve them. Kid-friendly, gut-healthy recipes. Feeding the healthy bacteria in your child's gut is as easy as plant-based pie, when they eat a plentiful variety of fiber-rich plant foods. While children might be picky eaters, these tasty recipes will help expand their palates as well as their microbiomes through foods, flavors, and textures they love. These recipes are also designed for children to be your sous chef in the kitchen. The more they help out with their own food preparation, the more likely they'll be to try new foods. This is great for everyone, you, them, and everyone's gut health. So get ready for some win-win-win family fun. Check out these 5 recipes linked below: fluffy buckwheat chia pancakes, mixed berry and banana fruit leather, oatmeal banana bites, green superhero dressing, and pumpkin chia pudding. Here's to raising healthy guts. Gut health is an important predictor of health, especially in children. Early intervention to encourage good gut health is paramount for health into adulthood, especially in the prevention of autism, attention deficit hyperactivity disorder, asthma, allergies, and chronic lifestyle diseases. By focusing on improving their lifestyle, environment, and dietary factors, you can set children up for healthy microbiomes and, in turn, a healthier brain, lungs, nervous system, and growth. And for all the big kids reading this, here's another tip. Most of what's good for little guts is good for your gut too. You just listened to 5 simple ways to improve kids' gut health using diet and lifestyle, Part 2 by Ocean Robbins at foodrevolution.org. And I'm your host, Marian Erickson. Please hit the like button if you're listening on YouTube, or give a quick 5-star rating if you're listening on Spotify, Amazon, or Apple. And please share this episode with anyone who might benefit, and thanks for listening.